Two.
Good morning. My delegate ID is 408. I'm Swati Shukla from Mahatma Gandhi Institute of Medical Sciences, Sevagram, Maharashtra. I have performed a research study entitled Risk Factors for Chronic Obstructive Airway Disease in Women. As we all know, COPD is a leading cause of morbidity and mortality all over the world. In many developing countries, it has been seen that there is a high incidence of chronic bronchitis in women as compared to men. WHO also estimates that 35% of COPD cases in low and medium income countries can be attributed to biomass smoke exposure. With this in background, I framed up my research question that do female patients with COPD have a higher exposure to poor ventilation, low combustion fuels and passive smoking? I conducted a case control study in the community in 3 villages surrounding Murtha district. A pilot tested questionnaire was administered to the cases and control, which includes questions regarding the housing conditions, the history of fuel use and passive smoking. The cases and the controls had undergone a pulmonary function testing in recent past. The medical student was blinded to the results of the spirometry testing. Later on, the data from the spirometry testing and the data collected by me was pooled up and statistical analysis was performed using Stata software USA version 9 Texas. Now coming to the results, as you can see, I took out the univariate and multivariate logistic regression for odds ratio and confidence interval, and I found out that the odds ratio for presence of mud walls and the presence of indoor kitchen without partition was significantly higher as compared to the other variables. This is in agreement with the earlier studies conducted by Balkrishna in the state of Andhra Pradesh. Therefore, I wish to conclude that women living in houses having mud walls and indoor kitchen without partition are at a higher risk of developing COPD as compared to the other women living in different settings. The study is a bit different from the earlier carried out of this kind because the only study conducted in India at a large scale for this particular matter was in the state of Andhra Pradesh, where women themselves smoke a lot. This is entirely different from the conditions seen in the Vidarbha region of Maharashtra, where you will hardly find a few cases of smoking. Also, the Vidarbha region of Maharashtra is a cotton belt area. So my study rules out the fact that exposure to cotton fiber increases the risk of developing COPD. This is how my study is quite different from the studies carried out in recent past. With this, I would like to conclude. Thank you.